You're listening to the Yoga Medicine Podcast. I'm your host, Katja. This podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts Tiffany Cruikshank and Rachel Land as we dive into all things yoga, research, and wellness.
Welcome back. I am thrilled that we have Dr. Stephanie Otto on the show today. Stephanie is a fellow sports scientist and fascia researcher. She has a PhD in human biology, and she is the head of exercise oncology at the Comprehensive Cancer Center in Ulm, Germany. Stephanie is really a forward thinker in exercise oncology with vast experience. She has been researching in the field for more than 30 years, and she's been training other sports scientists in exercise oncology for more than 20 years. And her research focus is on the link between fascia and cancer, which, of course, I find fascinating. And one of the aspects of her research comprise the interventions that are fascial related and cancer, such as myofascial release and also scar remodeling. And I'm really excited that we will chat about some of the biologic foundations of cancer development today, but also, of course, on some therapeutic interventions that are related to cancer, exercise, and fascia. And I am very excited for us to have you on here. Welcome, Stephanie.
Yeah, thank you so much, Katja, for your nice introduction, for presenting my research, my work so far. It's really a long journey, and that's right. I'm really very excited as well in the fascia and oncology field. There's so much to do, and we're just in the beginning phase. And of course, all my experience leads to these new identifications of research questions, and altogether I'm really fascinated to present my work a bit here, and altogether we can, I'm sure we will have a nice chat about some experiences in my journey.
Yeah,
thank you.
I am surely so thrilled because to me, exercise oncology is a new field. Generally, oncology is always seems like this big mountain that from a physiological or biological standpoint, I surely have not conquered. And so I'm really excited that you will give us a quick intro maybe into what really happens to our tissue when cancer develops, or maybe what distinguishes healthy tissue from cancer tissue and what happens within that progression maybe. Is that a good place to start?
Yeah, of course, we can start from that point and maybe move over to some therapeutic approaches, which are actually the ones the patients receive. And maybe I can start from that point, from the very beginning. So we all know that we have tissue and a lot of cells in our tissue. And when we suffer from a wound, for example, all this tissue and all this mechanism behind is working out well, and it's balancing, and there are many cells released from our own body, and it's all regulated very well. And in homeostasis, the wound will be closed in a few days, and we have a bit inflammation, but this will move up soon, and later, we have a scar, and the scar has to be get well again. But of course, it's never the same tissue than before. And if we have cancer cells, that's a big difference. Cancer cells divide very fast and they produce many, many different kinds of cells. And they develop different and strange tissues, and it's uncontrolled. There's no apoptosis, for example, or not in the right way. The immune cells dysfunction. The cells are growing and dividing differently, and these cancer-associated fibroblasts and tumor-associated macrophages and also other cells are worsening the situation and also leading the way for a bad immune function. It's all dysfunctioning, and we can think it looks like dysregulated thing, like it's all getting worse and not organized well anymore. That's maybe the point. All these molecular factors and all these tissue factors are not well organized anymore.
So the chaos kind of drives that tumor progression, which makes sense, kind of disrupting that whole balance of the fascial tissues there. And of course, I mean, also for us as practitioners or as clinicians, there's always the question, can we influence that chaos? Can we influence that disruption? I'm assuming the specifics of that are maybe not known yet, question mark. But maybe from a generalized standpoint, do you think we can impact, very generally, this chaos, maybe through mechanical forces or other modalities?
Yeah, that's what I'm thinking about since many years now. I'm very convinced that we can change the environment by treating the body and by doing exercises, special exercises. And I'm very convinced, for example, yoga and stretching. And there are many, many exercises partly have been shown in rodent models or in mouse models or in basic research that they can have an impact on the tissue and also on the tissue of cancer cells and tumors. And that has been shown by Hélène Langevin once and her team, that you have an influence on that to reduce the tumor size, for example, the tumor size by doing stretching.
Yeah, that is, oh my God, that is opening so many rabbit holes. Let me phrase my next question, and maybe we're moving over to the more therapeutic application side of things. But I understand that through exercise and through different modalities like yoga and other complementary therapies, one thing we can target are the biomechanics of the tissues. So stiffness parameters, which may then also influence other structures or systems, but kind of the biomechanics are one entry point for certain therapeutic approaches. Is that right?
Yes, that's right. It's the mechanical factors we can change, and of course we have different possibilities. Of course, in exercise oncology, since many years we are investigating also the effects of high intensity training. For example, it's a systemic part, and I always combine that. I don't only do some stretching. I always combine it with the traditional exercise oncology treatments like strength training and of course endurance training or some vigorous training, and altogether I'm sure we can lead to better understanding and a better improvement. But which training in which intensity, with how many approaches and whatever, that's really unclear. We don't know anything about that. We know a lot about quality of life treatments in exercise oncology, they're working out well, and you can improve so many side effects of the therapy. But are we able to have a better response of the therapy, for example, immune therapies in pancreatic cancer, which would be great, which would be fantastic, because there are a lot of non-responders, and that's because it's or that's why it's a very hard disease, which is difficult to heal and to treat.
So many things, so many questions. So combining different things, combining different interventions specified to the individual's need and how their cancer presents is complicated. And you are mentioning a bunch of things, one of them being kind of symptom-based treatments, but also you're mentioning a lot of things. And when I first heard you speak about this, I was so surprised actually to hear that with someone who has cancer in an, let's call it acute state, you would do high intensity training, resistance training, endurance training. And I was quite surprised of the range and also the intensity of interventions that you're using. And you're saying that's standard exercise oncology. I'm sure many of us are not familiar with how a sports scientist or exercise physiologist would actually work with a cancer patient. Could you give us a rough outline, like the best case scenario, that trajectory? Someone is getting diagnosed and go through their diagnosis and therapeutic journey. How would you work with them? What are the options or current kind of best practices that an exercise oncologist would be using or would choose from?
Yeah, of course. Thanks for this great question. And that's really the concern of many, is to listen to this podcast, I'm sure. But let me start from this part. We have a very, very big variety and a very, very big a range in this sickness. It's a cancer by itself, which is very heterogeneous. It's the entities, the tumor sites, the organ sites, for example, or is it blood cancer? Is it sarcoma, or is it prostate cancer? Is it developing fast or not? Is it, in which stage is the cancer site? In which condition is the patient? It depends on so many things that it's really very difficult for us as well, for us experts as well, to develop guidelines, for example, because we don't know everything about all these variants, but we have to investigate it step by step. What we can recommend now is that the patient should do the same as we, as healthy individuals. We should do 150 minutes physical activity per week. And that can be also 75 minutes by vigorous activity. So moderate 150, vigorous 75 minutes. And this should be some endurance training, and additionally, best of it would be to add two times of 30 minutes until, for example, 60 minutes, also some strength training. That's the recommendation also from the WHO. That are the normal healthy recommendations, and they are also very important for cancer patients. There's an example like the COVID patients. We thought this high-intensity training is working out for cancer patients very well, so why not for COVID patients with this long COVID conditions? But that was not the case. And for the long COVID patients, it was contraindication to do some very high level trainings, very intensive trainings. So they need much more relaxation therapies and probably breathing exercises. And this can be the case in some cancer entities or tumor sites as well. We don't know it yet. And what I can observe from my daily work and from my clinical part of work, which is very comprehensive since 35 years now, I can say there's always something to do. We can do always something. Like if the patient is lying in bed and at the wards, not doing anything all day long because not able to stand up, we always do exercise, and that can be very easy. That can be lifting the arms up and down or the legs, and walking in the bed, or just doing some lift ups with the with the stuff which is already there in bed. You can lift some bottles, for example, water bottles or whatever. That's the first step. And this is, of course, in the acute phase. We have different phases as well. We have the phase from the diagnostics, from the diagnosis to the treatment, or probably there's a window before the surgery, maybe after the chemotherapy, before surgery, for example, or after all treatments. We have this survivorship training, which is much different to the acute mode. And so it differs and depends on all that settings and situation, and of course on all comorbidities, because many patients suffer from many different morbidities, and sometimes they have high blood pressure, and you always have to adapt the training method and the training, of course, intensity, or these fit criteria, this frequency, intensity, type, and time criteria to the situation the patient is in. And so very good and easy is always to recommend some exercise like yoga or whatever they can do. Of course, they needn't do the difficult exercises. Yoga can be very difficult and hard too, but they can start with breathing exercises, with some stretching, with some walking in nature. I love outdoor activities. In the 1990s, we started from doing a lot of outdoor activities like skiing, walking, biking, and everything you could do outside. But also you can do some stationary ergometer cycling in the house if you're not able to go outside, because probably you have a balance problem due to the condition after chemotherapy or whatever, or you have a polyneuropathy, which is a different feeling in your hands or feet, which can lead to tickling or to itching or pain, and then maybe your movement is differing a lot from the normal movements, and you can be in a frailty mode as well. And also it depends on your age. If you're 80 years old, you needn't start with runnings or playing basketball, for example. There are so many things to think about, but of course it's kind of normal. You won't do that if you're 80 years old, if you're healthy or not. You won't do things you can't imagine for yourself. If you have never been sportive, you won't start with something dangerous there. Of course not. So we have a good safety in our own body system, and I'm very convinced everyone can do something.
I love the experience you're drawing from and that you're sharing with us. And I also love how the enthusiasm for your work comes out when you describe that. So maybe we could we could extend that conversation a little bit in two ways. I would be interested in that. Maybe first, we could chat about those more breathing or nervous system related approaches that also relate quite closely to yoga. So how that is integrated for or within exercise oncology. And then the second thing, we can put that on hold for the next question. But the second thing, of course, I would also be super interested in is how some of those exercise oncology interventions relate to the fascial tissues. So those two things I would love to cover within that conversation for the rest of our time. So maybe we start with those more gentle approaches, nervous system regulation approaches. Do you want to talk to that a little bit?
I love to talk about that because it's all these awareness movements and all these yoga concerned breathing exercise, whatever you call it, soft and gentle is the best to start from. And I have a group, we have a chemotherapeutic day clinic, an integrative oncology approach for patients with chemotherapy before operation, and they are so happy because they would never go to such a group exercise group sports setting. But in this integrative approach, we mostly do some breathing exercises, vagus nerve stimulation exercises, for example, because for me, in that phase, it's not important to stress the body much more than it is, then much better to do some relaxation movements. Movements are so different and you can do so many things. You can have an impact on the systemic field, as we talked about before, but you can also have a very good improvement on the vagus nerve, for example. Because I'm very convinced we have this stress level, and as soon as you get a diagnosis from cancer, your brain is full of stress, of course, and that lasts a very long time. And you can see that in MRI picturing imaging, for example, you can see that. So the body is, and maybe it was before the diagnosis, it was unbalanced. And we can see in many patients that the heart rate variability, for example, which is not there, you have no heart rate variability when the vagus nerve is inhibited, then you have a lot of, or you have the chance to have a lot of inflammation in the body. And this probably creates an environment for getting tumors. I don't know. We don't know exactly, but it can. And so this high level, this HPA axis, for example, this stress axis is overloaded. It's unbalanced. There's no parasympathicus. There's only sympathetic stressful nervous system working, and that's really hard for the patients because they don't feel that. They don't feel it. You can only measure it, and it's never measured. So it would be great if we would see this in the echocardiographic measurements. If there is no heart rate variability, we could immediately start with exercise, like, for example, doing some voice chantings, for example, or some vibration training for the vocal cord, for example, or you can do some breathing exercise. I love this box breathing, for example. It's so easy. Just breathe in 4, hold 4, breathe out 4, hold 4. This is so very easy to practice, and this calms down and this activates the vagus nerve, for example. And you can do a lot more, like fascial treatment, of course. You can do stretchings, movements. I love to do shaking the body all the time. We're always shaking, and we're always hopping, jumping if possible, for having these reflexes from the fascial point of view, and also having fun, of course. And we also love to dance. Dancing is also very, very good. It improves the cardiorespiratory system, as well as all these awareness, but also coordination system, and you have a good balance by dancing as well. But the main important thing is, I think, to relax. And so many patients can't relax anymore. They can't they think they lose the control if they relax, and they are not able to control their body anymore. But this step is one of the most important, to get relaxed, to have a good breathing mode, and to have enough oxygen, of course. That's the mechanical part, or the biomechanical part in it.
And I imagine that part that you're stressing is so important is, of course, very prevalent or very, very, very prominent upon diagnosis, but of course will probably fall, or they will have to deal with that or face that kind of stress to some degree throughout their whole lives. So having or creating that toolbox in case they didn't have it before, with those practices you're describing, and of course yoga can be one part of that, or some yoga techniques can be valuable there. That surely is helpful for them all the way, I assume.
Of course,
yeah,
it also improves their at the end it extends their life. There's some research about the morbidity or mortality rates in patients with no variance of the heart rate. So that's really quite interesting, and also maybe to build up this environment for getting cancer.
That is such an interesting hypothesis as well. I love you hearing talk about this. I have one last question, maybe, which is, in your opinion, in your personal opinion, or also in your opinion as a researcher, what do you think? What are the most important things on your table, your personal research table, or the research field of exercise oncology? So in your realm, what are the most pressing thoughts, questions, or hypotheses that need to be answered to progress your field?
Yeah, okay, we can start talking 1 more hour now. But I try to assume, and I try to make it easy as possible. Of course, we want to know a lot about the volume, the intensities, the entities, the different conditions. There's a lot to investigate. But for me, for my own interest, it's of very much interest to investigate the mechanism behind the function of exercise. What does it do with the molecular level, with the metabolism, for example? What can we reach out in our body when moving fast or slow, or when doing fascia treatments or exercises, and what's the influence on the cell level, and also what happens to the organ sites, for example? Do we have an influence? And all these osteopaths probably listening would agree to that. We also have an influence on the organic fascia, but we don't know so much about it yet. And all that I would love to investigate, and to know to really provide the patients the optimum of the knowledge concerning exercise oncology and beyond. But also we need a lot to do in the implementation field. That's a very, very big problem in our in our healthcare system, and it's not only in Germany. We have some approaches which are mostly study related, but in the whole world, people don't get exercise oncology. They don't get it provided from their healthcare system, and of course, but there is so much knowledge about the effects, and we have so much evidence on it, but it's not provided to everyone, and that's what I'm working on as well, to improve this field, to improve the politics behind, to show them as much as possible how important exercise is and how cheap it can be. To prevent patients from side effects or to have a better response, maybe.
I, for myself, am closely following your work, and I cannot wait for all you're doing, what will be doing in the future, and all your colleagues, of course, as well. So I am following your work. If anyone else on this podcast would like to follow your work, where can they find you? How to best follow and tag along the great work you're doing?
Yeah, of course, they can follow me on LinkedIn. That's my main field. I'm working regularly on LinkedIn, and I post regularly my own research or also research from my colleagues all over the world, because I'm always so fascinated about their own work, and you can't do everything by yourself. And I'm always so happy to read about them and their results. So I always try to catch up the most important research from my point of view in this long research life. And there you can find me mostly a bit on Twitter, a bit on Instagram, but that's only, that's not so much. Mostly on LinkedIn, you find my posts and my contact data. So whoever is interested, whoever wants to discuss a bit more, just get in touch, and we can try to find out more and probably have some good ideas together. And that's what I love. It's networking. So don't hesitate to do.
That sounds perfect. And we will, if you agree, include your LinkedIn profile or shortcut in the show notes, in the resources, so people can reach out and share ideas, discuss ideas. And I, for myself, am already looking forward to seeing you next time in person as well. But it was such a pleasure having you on here. Thank you for sharing your wisdom and your expertise and experience with us in this fast-moving field, vast field. So thank you so much for making this accessible, approachable for all the practical people on here, yoga interested students on here. So thank you so much for sharing with us. It was a pleasure.
Thank you so much, Katja, for your valuable questions, for your great comments, for your great thinking between the boxes, out of the box, between some boxes, or wherever in the universe. And I'm very, very glad to meet soon again to discuss more in person, and I'm happy to share everything you want to, and all these audiences is interested in. So thank you very much for having me here, and I'm glad to have the chance to give my opinion in your podcast and your questions here. Thank you.
Thank you. And thank you for everyone listening along. Till next time.
Thank you. My big pleasure.
Thanks for listening to Yoga Medicine. If you like the show, please be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you get something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com, or check us out on social media as Yoga Medicine. You can also email us at info@yogamedicine.com. Thank you for being a part of our Yoga Medicine community.
The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.